Here at PinPoint, we also help each other out. So today we're going to be treating the RMT Nadia here at PinPoint. So first, what we'll do is we'll look at her overhead range of motion. So we'll assess, see what she's coming in with. So what I'm going to do is I'm going to bring Nadia's arm up. We're going to see that she's stuck here. Overhead range is pretty stiff when we go into overhead flexion. We're going to look at it on this side over here, a little bit better. And usually that's due to a stiff trapezius muscle. Now we're going to look at the cervical spine here. So we're going to look at lateral flexion. As we can see too, we can see the increase in tone as she goes to the right side. We're going to look at the left side, but look at the difference in range of motion there. Just after a few orthopedic tests, we could tell there are things happening right here with Nadia's trapezius muscle. So to start, what we do is we're going to do a bit of soft tissue work. Things that also help with the trapezius muscle are acupuncture as well as IFC. So today we're going to work on doing a few passes. So here at PinPoint Health, we have an anti-inflammatory cream that we're going to place right on top of the muscle, and we're going to do a bit of myofascial release therapy. We're going to shorten the muscle here, and then we're going to lengthen, going along the muscle fibers. We're going along the muscle fibers, so we are guiding that muscle into better movements. Do you feel that little crack there? Yeah. You can see, and Nadia could probably agree as well, of how tight that muscle is. When we think of the trapezius muscle, there's also fibers that go from the shoulder to the neck. So what we're going to do now is we're going to shorten the trapezius muscle and we're going to lengthen. And we get you to shrug this shoulder up to the sky. Good. You're going to drop your left shoulder and we're going to lengthen away. Perfect. You're going to lift your left shoulder. Good. You're going to drop your left shoulder and we're going to lengthen away. Drop your shoulder. The neck, another muscle that connects from the rear part of the back right to the head, is called the longissimus muscle. To get to that muscle, this is usually that dull, achy pain we feel right here. And usually when you poke it, it's very uncomfortable. So we're going to work along that muscle fiber. This is called your longissimus muscle. So what we're going to do for Nadia is we're going to shorten the muscle because it goes from the mid-back right to the head. And then we're going to move the shoulder blade out of the way. We're going to tension the muscle down and we're going to go down and to the side. But yeah, for most people who have neck and shoulder problem, this is definitely one of the muscles that you want to target when doing soft tissue work. Your shoulder blade out of the way and guiding the head down. And what I'm feeling is that the muscle tone is starting to decrease. When you guide the muscle properly, the tightness of the muscle actually starts to give, and we're starting to get better range of motion. We're going to look at the overhead range of motion again. We're going to see that's a little bit better here. Now, when you think the scapula, it travels right on top of the thoracic spine. So now what we're going to do for Nadia is we're going to do an adjustment right here to the mid-back. So I'm just going to poke around. I'm just going to challenge the joints here. Nadia, we get you to place your arms down by your sides. Good. And right over here. So we see restriction right here in the mid-back. Nadia, we're going to adjust this segment here. With an adjustment, Nadia's going to breathe in, exhale, and I'm going to guide her breath. I'm going to thrust at end range. We'll do that one more time, Nadia. Get ready. Breathe in, exhale. So that high velocity, low amplitude thrust got those joints released. So now some patients, after getting thoracic spine adjustment, it helps with overhead range of motion. But what they find is that, let's get you to take a deep breath in. They're able to expand the ribs a lot better just by getting more movement here through the mid-back.